All right, everyone. We're going to talk about mastering the hip, and unfortunately, we can't master every diagnosis that comes through pertaining to the hip in this short blog. However, what we can do is to look at patterns, because I believe the chiropractors, or I should say providers, who are great pattern recognizers are the best at diagnosing. And the reason is because they're not wasting their time doing other stuff. They can hone in on that patient presentation along with symptoms, along with age, trauma, no trauma, acute versus chronic, and they can have a great idea on what's wrong with their patient. And then, most importantly, what to do to the patient. Because what we're seeing with evidence based care is it's not doing evidence based treatments, it's properly selecting which treatments to do for every patient. So I do think this blog is pertinent to all the subscribers that we have with ChiroUp. However, I think that at the very end of this blog, there's something that I think we can all rally behind that's going to kind of hit home the message that we want to get across with treating really any diagnosis in the body. I also want to cover a couple of things. One is a question that I have for you guys, and hopefully you can answer it. The second is going to be a thank you. And then the third is a recommendation. So listen for the whole blog, and hopefully we can get to the very bottom of this. But let's go through the blog first. So 6 diagnoses in the hip, and I think of the hip as prime real estate. And the reason I say that is because when it comes to the hip, it is location, location, location. So if you look at those 6 diagnoses, I'm going to kind of leave off the hamstring and the adductor part of this video blog because truly those are ones that are normally diagnosed based off location first, and then of course do the appropriate tests, and those are in the blog. And then when it comes to the other parts of location, the confusing ones are the groin pain. And when someone has groin pain, it really can go into the femoral acetabular impingement realm. It can go into a labral lesion realm, and it can also be hip osteoarthritis. So that's kind of one of those goofy ones. So make sure you look at the most sensitive and specific tests. The videos are on the blog. And then you go through some of those tips because those tips are extremely important. A lot of times we're masters at treatment, whether it's manual therapy, manipulation, mobilization, prescribing exercises. However, half of their treatment is not causing the problem to get worse. If someone has a disc problem and every morning they wake up and touch their toes 15 times, we don't have a chance of getting that person out of pain because they're making it worse every single morning. And the same can happen with the hip. We have these groin pain patients who sit when they drive to work or sit at work, and there's some things they can do for themselves and really do for you to help you treat them better. So that's what the tip section is in the blog. There's a couple of key tips to help you and help your patient get themselves out of pain. And I think this is where things really do get fun. That if you can get the right diagnosis and get the right treatment and then deliver the right set of exercises, it's going to be extraordinary for you and the patient when you start to recognize those patterns coming in and give them the right treatments going out. However, here's the reason I'm doing this video blog. Is because at the very end of the day, it comes down to should we be mobilizing the hip or stabilizing the hip? And this can change throughout the patient encounter and as they come through with a treatment plan. However, at the very beginning, for each and every one of these, I'm going to look for lost ranges of motion. Most of the time, it's going to be the inability to externally rotate and extend the hip. Not all the time, but for most of these conditions, that's what it's going to be. And if there's a lack of that range of motion, before I go through and start to stabilize that person and give them some eccentric exercise, some dynamic exercises, I need to get that range of motion back first. Once I get that range of motion as good as possible, then I can go into start to stabilize it. I'm going to do it very cookie cutter, and it's not based off of laziness. It's that you can start off doing things isometrically. Then you can move in to do things body weight dynamically. And then you go in to do things with resistance. Whether you want to do concentric, eccentric, wobble bands, resistance bands, or whatever it is that you do in your office, I don't care. Neither does the patient. It's all about progressive loading for each and every one of these. When we talk about progressive loading, that doesn't mean it has to be some fancy rehab program. You see all the rehab programs in ChiroUp. They're not sexy, but they work and they're easy to do. And it has to do with progressive loading. And people see progressive loading as strengthening, and that's not true. Loading starts with passive stretching. When you passively stretch a tissue, you are loading it. Not very much, but you are loading it. Then you turn into active range of motion. Are you loading tissue? Absolutely. And then you can move into more resistance or concentric or eccentric loading, and you'll see all those in the phase 1 and then moving into phase 2 exercise with ChiroUp. So we try to keep it simple on the patient and also the provider to make sure that we're progressively loading and getting that person out of pain. Tissue remolds, it remodels, desensitizes. People need to go through a progressive loading program regardless of the diagnosis. And making sure that whatever you're giving that person is something they can do. Just because it's the perfect exercise for everyone doesn't mean it's perfect for your patient. So now I want to get into the end of the blog. Please read the blog. The blog this was not an easy blog to write because it goes through just the clinical pearls, the things that I think about in the office, the things the research is hinting towards for each diagnosis. All those are written out in the blog. First, I have a question for you guys because, and hopefully it's pretty evident. I hate writing about manipulation, and I love manipulation. I love being a chiropractor. I love that aspect of what we do. But whenever I write about it, it's a flood of questions. And this is great, or this is terrible. The way I do it is better. And the last blog that I wrote on manipulation, crickets. There was not a single question, comment, criticism, and I enjoy all those on that blog. If you did not read the blog on joint manipulation, please do. It was a joy to write. The other one is a thank you. And this isn't something we normally do at ChiroUp. However, Tim and I are grateful, one, for the people who follow us via, chiropractors, but also our staff. And someone who's been with us from almost the very beginning, mailing out envelopes to doing marketing to now the director of operations is Sarah. And I want to say thank you to Sarah. She's someone behind the scenes that truly makes Tim and I's job easy. The reason we can do what we do is because of people like her and the people she leads. And the reason I want to say thank you, she got me a hat that says Steel Canyon, and I wear it all the time, and thank you. And the last one that I want to bring up is a suggestion. And someone asked me a while back about books to read, and I have to admit that I've been kind of focused on evidence-based books and treatment books and evaluation books and podcasts and that kind of stuff. And those are important to what we do. However, one book that I want to show everybody, and there's another book, Tribe of Mentors, but it's by Tim Ferriss. It's probably my favorite book. And it's it's pretty thick. It's not the whole book. The whole book is little stories. It goes everything from the Dalai Lama to Tony Robbins to, I can't even think about it. It just everybody. Tony Hawk is in there. The experts at what they do. Everything from the arts to music to business is in there. And kind of dig into their life and kind of see what makes them tick. So highly recommend that book. I have no vested interest in Tim Ferriss or his book, but it's a good one. And I think every chiropractor who's running a business and can benefit from learning from other people who have already done it. Thanks for watching. Hope you read the blog. And if you have any questions, please always let me know. Brandon at ChiroUp.com. Thanks.